welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Simple blood test can accurately predict neuroendocrine tumor to respond to radiopharmaceutical therapy. A simple blood draw can provide physicians with valuable information that can determine if peptide receptor radionuclide therapy or PRRT is likely to be effective in a patient with neuroendocrine cancer. The blood-based biomarker positive predictor quotient or PPQ can predict which patients will respond to PRRT with 96% accuracy. Changes in another biomarker, neuroendocrine neoplasms or NE test, correctly correlate with PRRT response in 90% of patients. 67 patients with somatostatin receptor positive gastroenteropancreatic and lung neuroendocrine tumors were included in the study. All patients had metastatic disease and had received prior treatments. Blood samples were collected before each cycle of PRRT and at follow-up, PPQ was scored as either positive, that is likely to respond, or negative, unlikely to respond, and any test was measured on a scale of 0 to 100, with the upper limit of normality being 20. Of the 67 patients in the study, 40 were classified as PPQ positive and 39 of them responded to PRRT. 27 patients with PPQ negative and 25 patients in this group experienced disease progression despite PRRT. The overall predictive accuracy of PPQ was 96%. Broccoli consumption protects gut lining and reduces disease in animal study. In a recent study, researchers at Penn State found that broccoli contains certain molecules that bind to a receptor within mice and help to protect the lining of the small intestine, thereby inhibiting the development of disease. The findings lend support to the idea that broccoli truly is the superfood. In their study, which published in the journal Laboratory Investigation, Purdue and his colleagues found that molecules in broccoli called aryl hydrocarbon receptor ligands bind to aryl hydrocarbon receptor or AHR, which is a type of protein called a transcription factor. This binding, they found, initiates a variety of activities that affect the functions of the intestinal cells. Study suggests Omicron to appear more deadly than seasonal influenza. Adults hospitalized with the SARS-CoV-2 Omicron variant have a higher death rate than those hospitalized with seasonal influenza, even though Omicron is considered less virulent with lower case fatality rates than the Delta and Alpha strains. New research being presented at this year's European Congress for Clinical Microbiology and Infectious Diseases in Copenhagen, Denmark suggests influenza and COVID-19 are both respiratory diseases with similar modes of transmission. In December 2021, influenza re-emerged in Israel after it went undetected since March 2020. At the same time, the Omicron had substituted Delta as the predominant variant. But data directly comparing Omicron with seasonal influenza are scarce. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.